Do you think a heart attack only comes with severe chest pain or a sudden collapse? The truth is, for women over 60, it's often not what you'd expect. There are no convulsions, no desperate cries for help. Instead, it's just a few days of unexplained fatigue, slight nausea, a vague backache, or even just a mild loss of appetite. Because these signs are so subtle and easy to mistake, up to 90% of women have ignored these life or death signals. Many have passed away in their sleep or while enjoying a cup of tea without ever knowing their heart had stopped. 1. In this video, I will help you recognize 8 silent signs of a heart attack in women over 60, and more importantly, how to act before it's too late. Please watch the entire video, because just a few minutes today could save your life or the life. Why do so many women over 60 miss the signs of a heart attack? If you've always thought a heart attack would strike with intense chest pain, profuse sweating, or a collapse in the street, the reality is very different, especially for women over 60. For them, the dangerous signs are often not dramatic. Instead, it can start with very vague feelings: prolonged fatigue despite resting, fleeting nausea, a dull ache in the back or neck, or simply a sense of not feeling well. Because these signs are so subtle, many people easily dismiss them, assuming they're just normal parts of aging, a change in weather, or mental stress. And that's precisely why countless women miss the golden window to save their heart. From a biological perspective, after menopause, estrogen levels, a hormone that protects blood vessels and balances cholesterol, drop sharply. When this natural shield is gone, the risk of cardiovascular disease increases significantly. But few women truly recognize this silent change. They remain busy taking care of their families, putting others' needs first, and ignoring the warning signals from their own bodies. That's why more and more cardiologists are warning about the state of silent heart attacks in older women. So what symptoms are truly worrying and require immediate attention? Let's find out in the next section. Symptom 1, aching in the neck, jaw, or left shoulder. You might think a heart attack always comes with crushing chest pain that's impossible to miss. But the reality is completely different. For many women over 60, the first warnings are often not in the chest at all, but in places you'd least expect: the neck, jaw, or left shoulder. What makes this symptom so dangerous is its vagueness. A pain that radiates from the chest to the neck or from the left shoulder down the arm is often ignored because you think it's probably just a muscle strain. But in reality, it could be a sign that not enough blood is reaching your heart muscle. When a coronary artery is narrowed or blocked, the related nerves send signals to other parts of the body. The result is you feel pain in unexpected places and often don't connect them to your heart. Many women have said they took pain relievers, used topical patches, or even applied heat compresses for days on end without realizing their heart was in danger. One documented case in the US involved a 65-year-old woman who thought she had cervical spondylosis because of an ache that radiated from her neck down to her shoulder. But just a few hours later, she was rushed to the hospital with a heart attack. This shows that underestimating unusual pain in the upper body can cause you to lose the golden window for medical intervention. The important thing to remember is heart attacks in women are often disguised by other symptoms. They don't look like the severe chest pain you see in commercials or movies. Instead, they're more subtle, less intense, but no less dangerous. If you feel pain in your neck, jaw, shoulder, or left arm for no clear reason, especially when it's accompanied by fatigue, dizziness, nausea, or shortness of breath, consider it a warning bell. Symptom 2, unusual shortness of breath. One of the most easily overlooked signs of a heart attack in women over 60 is a feeling of shortness of breath. It's not uncommon to experience this. You're doing something very light, like folding clothes, watering plants, or walking a few steps inside the house. But you suddenly feel like you just ran a long race. Physiologically, this happens when the heart isn't pumping enough blood to the body. When the blood flow doesn't carry enough oxygen to the lungs and other organs, the body immediately reacts by increasing its breathing rate, making you feel out of breath, winded, or even gasping for air after only a very small activity. The danger is that this symptom often doesn't come with intense chest pain, so the patient easily assumes they are just not feeling well. Many real-life stories show this confusion. A 63-year-old woman in the U.S. shared that while cooking as usual, she suddenly felt tired, had to lean on the counter to rest, and was panting as if she had just climbed a steep hill. There was no chest pain, and she wasn't noticeably dizzy. She thought it was just the humid weather. But just a few hours later, she was rushed to the emergency room with a heart attack. Cases like this are not uncommon, and they remind us that shortness of breath should never be taken lightly. The thing you need to remember is shortness of breath isn't always a lung condition, asthma, or bronchitis. In women over 60, especially those with a history of high blood pressure, diabetes, or high cholesterol, it could be an early warning of a silent heart attack. And if it's accompanied by other signs like extreme fatigue, nausea, or a feeling of pressure in the chest, consider it an emergency. Symptom 3. Persistent nausea, bloating, or heartburn. When thinking about a heart attack, most people picture chest pain, sweating, or collapsing in the street. Few would ever connect it with the stomach. But in women over 60, the heart sometimes disguises itself as a digestive issue. Many women have gone through this. They feel a heavy stomach after dinner. They burp constantly or even feel like vomiting, and they assume it's because they ate too much or their stomach is weakening with age. Some even buy antacids and take them for days to relieve the symptoms. But the truth is, when blood flow to the heart is restricted, the digestive system is also affected because it doesn't get enough oxygen. The result is slow digestion, causing feelings of bloating and indigestion, exactly like common digestive disorders. In a study by the Cleveland Clinic, many women hospitalized for a heart attack admitted that they had experienced persistent nausea and indigestion for many days beforehand, but none of them thought the cause was in their heart. Some even thought they had stomach ulcers or acid reflux. This confusion causes them to delay seeing a doctor and miss the golden window for medical intervention. The important thing is that you should not ignore this symptom or try to treat it on your own with stomach medications. Remember, a heart attack in women is often silent and easily hidden under different forms. If you feel your body is speaking to you through discomfort that seems to come from your stomach, listen more closely, because sometimes it's not a problem with your digestive system. It's a cry for help from your heart. Symptom 4. Unusual exhaustion. Imagine this. You've just woken up, and the morning sun hasn't even filled the room yet, but your body already feels heavy. It's not the kind of tiredness you feel after a sleepless night, but a feeling of profound weakness and exhaustion that makes you just want to sit still. For many women over 60, this exhaustion isn't from age. It could be a silent sign that their heart is in trouble. What's scary about this symptom is that it's so quiet. It doesn't come with severe chest pain or a choking sensation. It's simply exhaustion. Just a few steps from the living room to the kitchen can leave you breathless. A small task like folding clothes or wiping a table can make you so tired you have to stop. And because it's so every day, many women mistakenly believe it's just a sign of aging, the weather, or a busy day. But in reality, this could be a sign that the heart is no longer pumping enough oxygen-rich blood to the body. When the heart works weakly, the energy in every cell decreases, causing muscles and the nervous system to fall into a state of depletion. The biggest difference is, if fatigue is due to age or exercise, the body will recover after resting. But if it's from the heart, the condition doesn't go away. Instead, it becomes more pronounced, even when you're not doing anything strenuous. Many women have inadvertently ignored this warning. They think they're just not getting enough sleep, or their body is slowing down due to old age. But when the symptom lasts for many days, it could be the only golden window to detect and intervene before a heart attack truly occurs. So if you or a loved one over 60 suddenly feel unusually and profoundly exhausted for no reason, and it doesn't improve with rest, don't dismiss it. It might not be due to age. It could be your heart signaling that it needs immediate help. Symptom 5. Fleeting chest pain. When people think of a heart attack, the familiar image is of a severe, crushing chest pain that makes a person clutch their chest and collapse on the spot. But for women over 60, the reality is often different. Some women describe this feeling as a heavy object being placed on their chest, creating a dull pressure in the middle of their chest. Others say they feel a slight burning sensation, similar to heartburn or indigestion. Sometimes it's just a tight squeeze that lasts for a few minutes and then disappears on its own. However, medically, pain or a feeling of pressure in the chest, even if fleeting, can be a sign that blood flow to the heart is being obstructed. When the coronary arteries narrow, the heart muscle is deprived of oxygen, and the body sends out an alarm with discomfort in the chest area. The most worrisome thing is that this symptom doesn't always last until you realize how serious it is. There are real-life stories that prove this. A 68-year-old woman in Texas shared that she felt a slight chest tightness while driving, which lasted about 2 minutes and then disappeared. She thought it was just stress from traffic. But just a few hours later, she was rushed to the emergency room with a heart attack. If she had taken that fleeting chest tightness seriously and gone to the hospital sooner, the situation might have been different. According to the American Heart Association, a feeling of mild pain or pressure in the chest is one of the most easily mistaken symptoms in women. Because they often don't have the acute, severe pain of men, it's a dull, subtle ache that disappears quickly. This very gentleness hides the danger. If you've ever felt a tight squeeze, heaviness, or discomfort in the middle of your chest, even for just a few minutes, don't ignore it. See it as a warning bell and get checked out as soon as possible. Because sometimes fleeting chest pain is the very first sign that your heart's in danger. Symptom 6. Unexplained cold sweats. There's a sign that many women over 60 have experienced, but few ever think is related to their heart. Cold sweats appearing suddenly for no clear reason. You might be sitting and resting, not doing any strenuous work, not in a hot environment, but your body suddenly breaks out in a drenching sweat. Your shirt becomes soaked, and your hands and feet are icy cold. Medically, cold sweats occur when the autonomic nervous system activates an alert mode. When the heart has difficulty pumping blood and supplying oxygen, the body reacts by sweating to cool itself down and preserve life. In other words, cold sweat isn't just the body reacting to the environment, it could be a survival reflex when the circulatory system is under threat. A study in the US noted that many women hospitalized for a heart attack had experienced unusual cold sweats for many hours, even days beforehand. But most of them ignored it or thought they were just overly anxious. A 66-year-old woman said she would often wake up in the middle of the night with a sweat-soaked shirt, but she thought it was due to late-onset menopause. Only when chest pain appeared did she realize her heart had already suffered severe damage. The most dangerous thing is the confusion. Cold sweats are easily blamed on a host of other harmless reasons: stress, low blood sugar, or even just body changes due to age. But if they are accompanied by other signs like dizziness, nausea, or a dull ache in the back or neck, it's highly likely that this is not a normal symptom. The important thing is to listen to your body. If you or a loved one suddenly experiences severe cold sweats, especially while resting, treat it as an urgent sign and don't hesitate to seek medical help. Because when the heart can no longer maintain a stable blood flow, the body will send out a warning signal, and cold sweats are one of the clearest. Symptom 7. Unusual anxiety or panic. There's a very specific symptom of a heart attack in women over 60 that few people would ever suspect: a sudden feeling of anxiety, restlessness, or even panic. This isn't anxiety about a specific event, but a vague feeling that something terrible is about to happen, even when everything around you is perfectly normal. In fact, there's a scientific explanation for this. When blood flow to the heart is restricted, the central nervous system reacts by sending out an alarm signal. These signals are sometimes not expressed as intense chest pain, but rather as feelings of anxiety or panic. In other words, your brain is warning you that your body's in danger, but it's very easy to mistake it for an emotional disorder. The danger is that women often dismiss these feelings. They think they're being overly sensitive, or that they just need to rest and drink a cup of tea, and everything will be fine. Some even seek psychological help because they think they have an anxiety disorder, while the real culprit is their heart. Only when other signs appear, like dizziness, nausea, or extreme fatigue, do they realize the truth, and by then, it's often too late. Some statistics in the US show that women are twice as likely as men to be misdiagnosed while having a heart attack, precisely because of these unusual symptoms. As a result, many emergency cases are delayed, leading to more severe heart damage. If you or a loved one has experienced sudden, unprovoked anxiety, especially when it's accompanied by other vague symptoms like back pain, unusual fatigue, or shortness of breath, don't be so quick to conclude that it's just a mental issue. See it as a warning sign and don't hesitate to get a cardiac checkup, because sometimes a feeling of unease is a silent cry for help from your heart. Symptom 8, difficulty sleeping or waking up. Tired insomnia is a familiar issue for many women over 60, but there is a very specific and dangerous type of insomnia that is directly related to heart health. Having trouble falling asleep or waking up frequently in the middle of the night, feeling exhausted, out of breath, or with a heavy chest. Medically, this condition occurs when the heart isn't pumping blood effectively during sleep. The body is starved for oxygen, and the brain immediately wakes you up to try to save the situation. The result is a disrupted sleep cycle. You constantly wake up in the middle of the night and never truly get deep rest. Research shows this can be one of the earliest signs of heart failure or a heart attack. But because it's so similar to age-related insomnia, many women ignore it. The important thing to note is that many people try to fix this problem in the wrong way. They cut down on coffee, turn off their phones earlier, drink herbal tea before bed, but the condition doesn't improve. That's because the problem isn't with their habits, it's with their heart. If your heart isn't working properly, no matter how many sleep tips you follow, your sleep will still be disrupted. Another point of confusion is that this phenomenon is often accompanied by vague symptoms: mild nausea, prolonged fatigue during the day, or a slight chest tightness with activity. So many women tend to attribute them to stress, anxiety, or age, instead of thinking about their heart. And this complacency has led to many people falling into a dangerous situation right in their sleep. As a silent heart attack quietly strikes, if you or a loved one regularly wakes up in the middle of the night feeling out of breath, completely exhausted, or with a heavy chest, don't take it lightly. This could be your heart's final silent warning before a real heart attack occurs. See it as a serious signal and get checked out immediately instead of thinking, it's probably just age-related insomnia. You've just gone through the 8 silent signs of a heart attack in women over 60 with me. What's striking is that most of these symptoms are not loud or intense. Instead, they are very subtle and easily mistaken for fatigue, stress, or other common ailments. This very stealthiness is what causes many women to miss the golden window for emergency care and to protect their hearts. If you found this video helpful, please hit the like button to spread this message to more people. Don't forget to subscribe to the Senior Health Guide channel and turn on notifications so you don't miss the next videos about heart health and tips for living a healthy life after 60. And most importantly, share this video with your mother, sister, or any woman you love, because your small action today could help someone recognize the signs in time and save their life.